Welcome to the Occupational English Test, also known as OET. This is the listening subtest. In part B, you will be given 6 different short recordings. Usually, the questions include identifying a gist or a summary of the information. It could be based on workplace communication. You must look for the speaker's purpose or any specific details depending on the type of question you are answering. The question types may also cover opinions, function, course of action. Sometimes you will find specific details within the interactions. The time duration suggested is not to spend more than 45 seconds in part B per question. You will get workplace interaction like briefing or handover. It is suggested that you take 15 seconds to look at the questions and 5 seconds to mark the answers, each of them. Now, you must listen and answer simultaneously. There will be at least one healthcare professional in each recording discussing a range of contexts. They are usually based on very generic hospital questions. You will hear 1 or 2 speakers. In most cases, there will be 2 speakers. Let us look at some strategies to do part B. For questions 25 to 30, choose answer A, B or C. This is how part B begins. In the previous part, you ended at 24. You will start with 25, which will go on till 30. This is your first set. They have generic hospital-based contexts. Ideally, you ask questions that are based on gist. Now, gist questions basically ask you for overview of information and not any specific detail. Here, the information may be rephrased, so it is suggested that you look for differentiating words or words that might be similar in meaning. Differentiating words can give you the opposite meaning, so then you will know that the information is not correct. The next, detail. Here, a specific part of the recording is suggested. You have to pay attention to a specific part of a recording. Check for synonyms or rephrased lines. Next, some questions may be based on the speaker's purpose. That could include what or why the speaker is talking about a particular topic in a particular manner. The next could be function based. It could be discussing or it could be asking you to select something related to what the speaker is doing, or what the function of what the speaker is saying or both the speakers are saying is. You need to understand the actions that this language describes. Finally, opinion-based. Here you need to identify the opinion of a speaker on the issue discussed. Pay attention to how the speaker says things and the attitude towards the topic. The next one you have is agreement-based questions. Here you need to identify what the speakers are in agreement about, listen to the conversation, and pay attention to the reactions of each speaker to the other's suggestions. You need to decide what the speakers will do as a result of the conversation or talk. Pay attention to anything that will be done later while listening to the recording. Be aware of when in the future the actions will be done. So these are the type of questions that could be asked. This is practice part B. This is how it looks. Your instruction is given here. As you can see, questions 25 to 30. This is your context. This is the question asked. This is the kind of recording you will be hearing, and these are your options. You need to select the best one within the context of the given question. This is practice part B continued. Continued again. Now this is the end of part B, the 30th question. Now you need to look at part C. Now here are some general listening tips. Familiarize yourself with the instructions. This is usually accessible to candidates across all professions, so anybody can take it up. Use the time given before the task to look at the questions. Read through the questions first during the time provided. Multiple choice questions require you to underline keywords in the questions and the options so that it will be easier for you to practice. Write clearly and legibly. In note completion questions, underline important words that appear before and after the gaps so that you can use them as clues and try to match the information with what you've heard. The recording will be played only once, so listen very, very carefully and record your answers as you listen. Fill in all of the gaps in part A. Select an answer choice for all of the questions in parts B and C. You will not lose marks for incorrect answers. That means you will not get negative marks. If you miss, just move on, return to the question later. It is suggested that you listen to general English accents every day, and that could include British, American or Australian. Try to listen to as many podcasts and videos as you can. This usually includes 12 different healthcare professions, namely nursing, medicine, physiotherapy, dentistry, pharmacy, veterinary, occupational therapy, speech pathology, dietetics, optometry, radiography, and podiatry. That is the end of this training video. All the best with your practice.